Welcome back to Holistic Healing Association. I'm Erin D'Arcy. I'm certified in embodied processing and clinical hypnosis. Today, we'll be doing a deep dive into disassociation, complex trauma, and complex PTSD. I have Esen, who's a trauma therapist who specializes in PTSD, complex trauma, and disassociation. It's an honor to have you.
Thank you for
And
having me.
thank you. And would you like to tell us about yourself?
Sure. I have been living in Australia last 34 years, and I end up here because my partner was refugee at the time. So he came, then I came. So and then I studied social work. I was very interested with humans and their stories, what they need to tell. Then I decided to study family therapy because we are part of always bigger system. And I always find fascinating how people present themselves in person by themselves and then seeing them in the family dynamic. And that was fascinating, like what we feel about ourselves, who we are, and then how we are in the family. And that was fascinating for me to see. So I decided to study family therapy to understand the dynamics and then how we fall in our roles in that dynamic. So I studied family therapy 10 years later after I finished my social work. And then, I suppose it was almost my calling to work with the refugees. So I fall into the trauma field. And then, I moved to sexual assault, working with the victim survivors of sexual assault. And that was the part that my understanding of trauma and dissociations really deepened because I worked for an organization who was very big on training of their staff, improving their learning. So that was, I suppose, me emerging as a trauma therapist and understanding dissociation because I find dissociation is fascinating. And through my own therapy, I connected a CP therapist, and I really love the way he worked with me. And I really love the changes that I was making. And I asked him, what are you using? What is this modality? And he said, somatic experiencing. And I just, registered myself for the training. And since then, I'm in the somatic world. I'm just trained with Kathy Kane and Aline Lapierre, and I'm trying to improve my, knowledge in the area more, so I can provide, I suppose, safer kind of support to my clients or gentler kind of support to my clients who is mainly have developmental or complex trauma. So yeah, that's me in a nutshell.
Okay, well, thank you. Yes, we can always learn and grow and experience
Yeah,
more. Yeah.
yeah,
Life's a journey.
exactly, exactly.
And would you like to share your trauma story with us?
So, I born in Middle East, as I suppose everyone would know. Middle East has a lot of upheaval in their history. So, in that sense, that I born into that, like seeing military coups and seeing people being tortured and killed and being shot. So,
You have been shot?
no, not me, but I've seen other people being shot. And when you grow into or born into that, so the trauma becomes part of your life, and that becomes, as Thomas Hübel talks about in his book Collective Trauma, it becomes the culture. So I born or grow up and live in that collective trauma. Of course, my parents took their own fair share from that and their intergenerational trauma into it. So in that sense, there was a attachment injury in my family, and that was, you know, transferring from one generation to next. And me and my siblings got our fair share from that too. And like, you know, so and that I suppose like, you know, that really shaped me as a person who I am. And like, you know, I always thought that I stumbled into the trauma work by sheer accident. Like, you know, it was just the work available, I took it, and or maybe a little bit influence of my ex-partner being a refugee and getting trauma. But when I read or reflect back now, I'm thinking, I mean, where else I could have gone? Like, you know, it makes I suppose subconsciously I've been pulled into it because I understood, because I've gone through it. So yeah, like, you know, I have my personal, I have my collective, intergenerational. So, and that shaped me who I am today and how I suppose function and how I can you know, connect my clients better in to a degree, because, you know, I think they say it, wounded healer. So like, you know, we all have our own wounds, and that sometimes support us to understand people in front of us. And like, we won't know exactly what they feel, but we can relate to it.
And give
And sometimes
us.
that's good, and sometimes not so good, because transference and counter-transference might get in the way. But there's a supervision for that. So yeah, that's me in a nutshell.
Thank you. Thank you. Okay.
That's all right.
And what is complex trauma? How common is complex trauma and complex PTSD with developmental
Mhm.
trauma?
Look, people would like to think that complex trauma or developmental trauma is not as common, but unfortunately, it is quite common. Like, you know, there's a study, I think, adverse childhood experience study has been done, and the numbers were quite high. So in that sense, that we can easily say that trauma is way more common than people would like to think. And complex trauma is like, you know, going through more than one event regularly, and not being able to escape from it. And usually the kids are the one that cannot escape, or if you're in a war situation that you can't escape. And majority of the complex trauma that I deal with are relational kind of trauma. People get injury from close relationship. So, and that's long term, that it's just kept continuous. So, and like, you know, being exposed to that chaos or neglect or attachment injuries long term, I would say that's complex trauma. And developmental trauma has been described as a bit more specific, like they say the All Resources says between 0 to 3 years old, when if you are exposed to you know, abusive parents or neglect or lots of attachment injuries, then there is a developmental trauma. Some researchers says 0 to 3 is not capturing, they say 0 to 5, but nonetheless, that like, you know, developmental trauma is starting very, very early in the piece, as soon as you're born, even in maybe in the utero. And then and that is continuously there, and therefore the your brain development is changes, and because body is smart, mind is smart, trying to protect itself. And that, like, the physiology of brain and even your muscle structure changes. And I think that's what they call the developmental trauma. And that specific period, complex trauma, I mean, at least in my mind, is continuation of that, starts early and doesn't end. Because, if there is that kind of neglect or trauma in the family system, that usually doesn't end quickly. It just continues.
And how does complex trauma impact people?
Mm. Complex trauma impact people on so many levels. Like, it impacts on them body, emotions, mind, sensation, and even the muscle structure. There is a great book called Emotional Anatomy, and it talks about that, how trauma shapes us and internally and in muscle, our muscles. So it impacts on everything that you can think of, your relationship with yourself, your relationship with others, with the world. And like, people might be always on the edge, just searching for where the danger is, or shut down, that they can't see what's going on around them because everything is too much. And it impacts on people's memory, trusting others, and I don't know what else that might be. Yeah. So I would say it impacts on everything. Was there
Okay.
any second part of the question? Did I miss that?
Yes, so just with PTSD, how can PTSD impact people?
Oh, look, I mean, complex trauma and creates PTSD or complex PTSD, that would impact on every aspects of their life. Because, once there's safety and self-compassion is beaten out of your system, and life won't be easy. Life would be very hard.
Okay. And how can somatic processing help?
Mm. Somatic processing helps people because majority of the therapies targets the thinking brain and do talking therapy. But when you think about the trauma is not in cognitive, it's not the fault of your thinking. It's in the physiology, it's in your nervous system. So, and that's what somatic therapy does, works straight with your nervous system. And therefore, somatic therapies is great creating safety and stabilization, while people might be chipping tiny teeny off their trauma history. But so it creates regulation in the system, and then therefore people can have better quality of life, and they might still have their trauma, like, I always say that we all have our own neuroses, but we learn to live with them. And I think somatic experiencing support people to function, even though they might have some impact of their trauma, they would learn how to manage. The idea of trauma work is to I mean, at least in my work, I'm aiming to support person to live, symptom free from their CPTSD or developmental trauma. But if sometimes it's a long journey, and during that long journey, the idea is they can live, create some sort of safety in their life, and that would support them.
Okay. Okay, and safety is huge. Safety is the
Oh,
first step to healing.
yeah, safety is paramount. Like, without safety, there's nothing can be done. Like, if you can't establish that, forget it. You can't do the any trauma work, because when the client is not feel safe, they check out of they check out. They're not in the room. They're either in their head or dissociated or collapse. Safety is the first and foremost in the therapy, because if you don't have it, you don't have the client with you.
Exactly. And what are some strategies that a therapist can use to help the client feel safe?
Look, the strategies that I use is creating physical safety in the room. And that's may sound a bit, I don't know, simplistic, but people needs to feel safe in the environment. If there's a medical trauma, or if there is a, I don't know, sexual assault trauma, the room needs to be safe. Like I used to work in the past, a doctor's, I was sharing with a doctor office, and there was a trolley in the room, and then the hand wash basin in the room, and that would trigger the people. So I had to cover all these areas, because people have different kind of history. So the room needs to be friendly, safe. That's one thing. And also, what I do when the client is in the room, I do a lot of grounding orientation to increase their safety, and connecting them some safe item in the room, one, two, or whatever the amount. And distance between us. I mean, we're all bound by what kind of room we are working. Like we have limitations, but still, I offer check what kind of space that would support them feel safe. And I have blankets that I use in the room, that weighted blankets, or scarf, so they can hide, because some people want come to room and they don't want to be seen. I have scarves. They hide behind the scarf. They can see me. I can't see them. And any way I can support the client's safety, I would do that. And but yeah, I suppose what I'm trying to say is physical safety, emotional safety, and also, supporting them with the groundedness work, and the orientation.
And until we start to feel safe, we're not able to feel into our bodies because we'd
Yes,
be too
exactly.
scared, right? And that's
Yes,
it's
exactly.
common that people are afraid. They don't want to feel into their anger. They don't want to feel into whatever's coming up because it can be intimidating. But if we can start to
Oh,
feel safe, just like turning on a tap a little bit at a time, we can start to process our emotions. We can start to feel our emotions.
yeah, exactly. Exactly.
Because when we don't face our traumas, they will repeatedly come back into our life over and
Exactly.
over and over. And we will feel like we were repeating it in our
Yeah,
bodies and our
yeah,
emotions.
yeah,
And it may not be logical, but our bodies remember. And triggers can bring out a lot. And when we face our triggers and we look at our triggers, they're telling us something. And it's so important to listen and then start to resource and feel into starting to feel safe and doing grounding techniques.
hmm exactly, exactly.
And what is dissociation? And what is the cause of dissociation?
Dissociation is something that very, very protective when it comes to trauma. We all have it. We all do it all the time. We dissociate. Like if you are traveling from your home to work 10 years, you would travel in between and you won't know if you pass through the red light, if you follow all the rules on the road, because you've done it so many times. That's a form of dissociation. So there is a spectrum in the dissociation that we have. And but when there's a trauma, the spectrum, like, the one that I mentioned, like, when you travel, you don't remember what happened.
Yeah,
That
I've done
does.
that many times.
Yeah, same. Like sometimes I would ask myself, did I kill anyone on the road? Then I would think, oh
It's
no,
just
if I
like
did, I
driving
would
along,
know.
or you're driving and it's
Yeah.
like, wait a minute, I didn't mean to go here. I'm going somewhere. Then you, because it's just
Yeah,
like
yeah, yeah,
routine,
exactly. Like
right?
if you get used to it, and like, going to work and then you are in the autopilot, you forget where you were going. I've done that too. Like, I just end up at work on Sunday. I wasn't meant to, but so I
But
forget
there's a
where I was
spectrum,
going.
right?
Yes,
There's a
yes,
big
there is
spectrum, and some
spectrum.
people like it's to the extreme
Yeah,
more.
yeah. Like, I mean, there is spectrum, and when there's a trauma involved, there's spectrum, like, the dials up more. And what dissociation, people call it zoning out, or feeling like out of body experience, and like, they don't feel like themselves real, or the world is real. So there are different kind of dissociation happens, and and that, like, depending on what kind of dissociation you are having, there's depersonalization, like you feel like you're not a real person, and derealization, you feel like the world is not real, or out of body experience, like you're watching yourself from a distance, or zoning out, or amnesia, like, you go through things and you don't remember them. So yeah, like, depending on the personality, and then the past history, people experience dissociation differently.
And how can disassociation feel in the body?
That might feel like numbness, or feeling heavy, or feeling behind the fog, that you can't see things, or might feel like you're floating, and then you can't feel your emotions or senses, like, that numbness feeling. Sometimes people describe feeling dizzy, and like, and that can be very scary, like, almost like when you're in the lift, that when the lift suddenly stops, and then it feels like your stomach jumps, it might feel that way. And then, like, they can't feel themselves, the substance of themselves feel like missing. Yeah, so that's usually what people describe. And also, when I'm in connection with my clients, I feel some of those feelings. I feel, oh, I can't see you. And then when we check, they say, yeah, I'm dissociating, I'm leaving the room. Or they might feel like, you are living in very close proximity with the person, but the person feels like 2 kilometers away from you. And like, and that might feel that way as well.
And people with the developmental trauma, it's approximately 100%, I believe, dissociate.
Look, Bessel van der Kolk says that, like, if there's a trauma, there's definitely dissociation. It's a package. But I mean, I'm sure there will be exception to circumstances. But most of the time, dissociation is part of trauma, because when you can't escape the situation, especially as a young child, the first thing you would do is, if you can't escape it, you'll find a way to escape it, and that dissociation is great for that. And they will check out whatever way they can. So I would say that yes, it's incredibly common, but as I said, there's always exception to circumstances.
Okay.
Mhm.
And what age can we start to dissociate?
I was looking that information. Like, Alan Shaw talks about infant start
I
dissociation.
was reading that too.
Yeah, yeah. And look, it makes sense because if you, as I said before, if you can't escape the situation that you're in because you're a baby, and if you can't object to the situation you're in, you will find a way to manage it. And dissociation is a great one. So Alan Shaw says that it starts very young, infant, and I agree with that because some of my clients are great dissociators, amazing, and that's how they protected themselves. And they're functional enough in the world to hold a job and have relationship and to manage any scary events in their life. So yeah, I would say very young. And that explains better the DID, like the dissociative identity disorder, that usually, according to the scholars, starts quite early developmental trauma, and you learn to split and you learn to manage the situation that you're in. So it's young, early.
I believe that. And I believe that there are many that if they have been doing it since they were an infant, they most likely have been doing it throughout their whole life.
Yes.
And those are
Yeah.
people that are very good at dissociating
Yeah. Oh,
and
yeah.
using
They're excellent at it.
grounding techniques to help bring yourself out when you realize you're dissociating, right?
Hmm.
To bring yourself back into the body, back into feeling safety.
Yeah, look, sometimes dissociation is helpful. Like, I used to work with a client that who was living in a body that had so much pain. And when I tried to do the, bringing her back to the body, it was like double whammy. Like, what do you do when I'm inside? I feel so much pain. When I'm outside, I feel less. So, like, like grounding or trying to bring back the person into body is not always works for everyone, depending on what they're presenting with. But the idea, of course, bringing them back inside the body, because then they can also experience their joy in 100% rather than, like, feeling that they're under the water. They can only feel some of it. And also that would create more awareness around a risk around them so they can be protective. But again, like, depending on who's in the room, and that kind of client, I would say, can you come back 5% in your body, just 5% rather than 100,
And
to
that's a
create
perfect
that.
example of being underwater,
Yeah,
like not being able to feel it,
yeah,
experiencing it, right? Or like being like in like a jail or a glass and you're like looking out and you can see it, but you're not fully
but
experiencing it.
exactly, exactly. Like, that disconnection from self and others.
Yes. And for parents that their children are dissociating because they haven't experienced a trauma, what advice
Mhm.
can you give the parents?
Look, what I would say, that I think parents being embodied in themselves is a great support, and then providing safe environment, and also engaging with the kids, attunement, and trying to support them, ground them, and then showing them they're safe. And I think that would be a great support. But I suppose having very attuned and embodied parent would do a lot of difference in the child, because then the child would feel that, because our nervous system is connected to one another, that through that co-regulation.
Makes perfect
And that would,
sense.
yeah, that would bring the child back. And I think kids are brilliant at with games or playing. And when they play, they I believe they will fall in back inside their body, and playing with the kids, that's their language. Like, and then talking them in their language while you are keeping yourself inside with full attunement.
And giving them presence.
Yeah,
Even staring
exactly.
just face to face and just giving them that presence.
Exactly.
And
Exactly.
if they are showing an emotion, sit with them.
Exactly.
I allow
Like,
them to feel it and say, for example, I have a 3-year-old daughter. She's feeling sad. I'll say, I'll sit and feel sad with you.
mhm,
And allowing them to know that all emotions are okay. There's no bad emotion. If she's angry, it's okay. She can name it,
mhm,
and
exactly.
teaching her how to process their anger, right? And it doesn't mean when we get angry we can lash out, but
Mm,
we can still feel all our emotions, and teaching our children to process and to feel our emotions is a step.
exactly. Yeah. Yeah. And giving a room to their emotions, accepting it, that will
and
teach
making us
them, yeah, whatever I feel is okay.
and making it a safe place to feel.
Mhm.
And what is the connection between addiction and dissociation?
Like, if addiction and dissociation would be humans, I would say that they're the first cousins. Like, they're there to support the person when they go through the difficult times or going through trauma. Um, Dissociation is when we can't handle and can't escape. And this is what we do physiologically or psychologically to leave. And addiction is even dissociating, because some people maybe can't dissociate as effectively as others, and or dissociation is not enough. Then you would find another way to numb it, self-medicate it to feel good, I suppose, to feel happy or alive, or not feel the pain. So they're closely connected, and they have similar roles, but different, I suppose, presentations in a sense. Depersonalization is like, you don't feel yourself real. So when you don't feel real, how, like, how could you have a real relationship in people in front of you? Because that means that you're so disconnected from yourself. When we are disconnected from ourselves and our bodies, it's really hard to have that meaningful connection with the others. Like intimacy would be, emotional intimacy would be incredibly difficult because you're not inside. Like emotional intimacy requires embodiment. You need to be inside and you need to be connected to self. So yeah, like you will have relationship with others, but it won't be as, I suppose, um, you can't feel it. And eventually, because we, our nervous system, I always say that to my clients, our nervous system talk to each other, co-regulation. And so what will happen, the other person eventually will catch up, will know that there's something is not landing on your side. And that will impact quite badly on the relationship, because the other person might feel lonely in that relationship, because
Mm,
you are
I've
sort of
experienced
there,
that.
but not really there.
Yeah, exactly. I've definitely experienced that. And it's not
Sorry,
easy
I'm
to
just.
be on the other end.
Yeah.
But we
Oh,
need to remember it's not the person's fault. There's no
no, definitely not.
intention of it. It's trauma.
Yeah,
And
yeah,
trauma can
exactly.
impact us in many ways. And it's important to be compassionate and understanding and meet
Exactly. Like,
people where they're at.
Yeah, yeah. Like, I mean, depersonalization is protective measure. And what we use and what works, we want to use it all the time because it worked then. Only problem when we grow up, it doesn't. And that doesn't mean we can't change it, but that will take time. But yeah, no, definitely, like, this protective mechanism, it's hard for the person that not being able to connect, let alone you, to themselves, not feeling real. It's hard, but um, they require time to make changes.
Healing,
Yes.
healing. And it can't be up here.
No,
It has to
definitely
be
not.
in the body,
Yeah,
right?
exactly.
Because conflictly, they're not, it's not they're thinking, oh, I'm going to be doing this. It's a reaction that's happening in the body. And so if we can start to process our emotions, feel into the body, start to heal, and understanding our trauma
Hmm.
can significantly help.
Of
And if we
course.
educate ourselves, but that's not enough. We need to be able to start to heal in our body,
Yes. Yes.
right? Not just
Yeah.
understand, also heal.
Yeah. Look, I mean, it's like, knowing, not necessarily stop doing it. Like, I knew that smoking bad, but didn't stop me smoking many years. So knowing doesn't translate doing it. Doing it takes time. And it's in the nervous system, and that's what we work with. The body, the mind, the nervous system. And cognition is, of course, part of it. We make meaning of our experiences, but change doesn't come from, oh, that's that. So I don't need to do it anymore because I'm safe now. It doesn't work that way. Nervousness system needs to feel I am safe now, rather than I mean, head is good too, but by itself is not enough.
We're not going to feel safe unless we can feel safe in the body.
Mhm.
And the first step
Yeah,
to healing
exactly.
is feeling safe.
Yeah.
And what are the symptoms of complex trauma? How can we work with? I know, for example, one symptom of complex trauma would be low self esteem
Mhm.
and shame.
Yeah.
How can we start to process our shame or low self esteem?
Mm. Look, what I would say that the symptoms of complex trauma is like, if you are in war with yourself all the time, and then if you have no self-compassion, and if you have plenty of shame and very low self-esteem, definitely there's that complex trauma in the system. Because that's what it does. It creates internal war. What you did was wrong. What you didn't do was wrong. Like, everything becomes, um, everything becomes very hard. And how do you work with shame and low self-esteem? I suppose one, understanding about what the person feels shame about, because we need to involve the cognition that sometimes we learn to feel that we are like, if you don't do this, you're lazy. If you and like, if you don't understand this at once, and you are stupid. Like, understand the cognition behind it, and then maybe correct it, that this is not right. But also working with the nervous system. When you feel the shame, what comes into, what do you feel in your nervous system? What do you feel in your body? And I suppose staying with that in a safe way, like, while maintaining the safety, not getting lost in it. And then working with that, cognitively, but also the impact in the body, and exploring what it is not right anymore, because, people being told you're ugly, you're stupid, you're this, you're that, and then challenging those beliefs that doesn't belong to them, but the history with whomever, and that would be helpful. And sometimes, like, what I find helpful, I ask people to bring pictures of their childhood. And we sit and talk about that child, like, and or sometimes do parts work saying that if there's another you sitting in right front of you, like, and please tell her that she's stupid and she's ugly or whatever the internal. And majority of them can't. They said, no, I can't.
Mhm.
And like, just sort of bringing to the surface that what they're doing to themselves.
I love that.
And also, like, making them realize, is this their eyes? Like, we do, whose eyes I'm going to use, my own eye or my, usually parents, I'm going to say parents, give that messages, or I'm going to use my parents' eyes. And parents were, I mean, I'm sure they had their trauma as well. And they were, we only can give what we receive. They were giving what they received to their child. But then I would say, when you look at from your mum's eyes to you, what do you see? They tell me. And I say, okay, we check the picture, or we do parts work. There's another you just sitting right next to you. Look at that person. What do you see from your own eyes?
Looking at your
So,
mother's.
yeah, like, your own eyes. And if their eyes is really harsh because sometimes they can't connect, then I ask, like, trying to find if there was a people in their life, any people that looked at them with love and care. And I bring that person into room, and then we try to um, hold that to change the shame, change the low self-esteem, and increase the self-compassion. Because one of the big loss that I find sad, the self-compassion people lose. Because when the main carers or people around you doesn't have it for you, you learn not to have it as well. And the hardest to bring it back. And so, yeah, like, I would try to increase that self-compassion. Then, like, if the person feels shame, they can say, hey, it's okay. It's okay. You know, um, and I find doing very helpful, doing purposeful disclosure, like saying, hey, I know how shame feels because I felt it in my life too. It's crippling. But let's try to look at someone's loving eye if their eyes is not available to them. And what would you say to this person? What they would say to this person that you are saying they're terrible. So
I
that
love that.
kind of,
Yes.
yeah.
I've interviewed many therapists, psychologists, psychotherapists. They've never mentioned anything like that. And
Mm.
I find that I love it. I think I will be using that.
Um,
So
and
that's great.
sometimes, like, since you like that, I'll tell you one more thing. Sometimes what I do, I ask the client that themselves, and I say, I'm you as well. And I just stand up and say, why you're so ashamed of me, what I've done. And that's quite powerful, like, and so, yeah, look, because, we don't know when it's inside our head and or inside our system, we are keep doing it. But when you sort of externalize it, it really helps people what they're doing. And when they do it next time, they think, then the inner self says, why you don't like me? What did I do to you? So it's a good work. I like doing that.
And noticing when you're looking at these photos, noticing what's happening in your body, right?
Yeah,
How you
yeah,
feel.
exactly. Yeah.
And what's the connection between complex PTSD and addiction?
Complex PTSD and addiction, I think, as Bessel van der Kolk said, trauma and dissociations are a package. They go hand in hand. I would say that addiction and complex PTSD is also goes hand in hand. People, when I talk about addiction, or when we talk about addiction, people think about the substance abuse, like serious stuff. It's not necessarily that. Like we might have addiction to, eating or not eating, or going gym every day, over exercising, overworking. And because when you don't want to feel the symptoms and something is feeling horrible inside you, of course you're going to find a way to manage that. And dissociation is one, addiction the other. And we all, in SE language, they say the management strategies. So we'll find a way to manage our symptoms. And addiction is a great way of managing. In the long run, it doesn't work though. And everyone knows that and they want to change it. But it's like dissociation, protective. But in time needs to change because it doesn't work for people. And when it doesn't, people then say, hey, I have this habit and I can't stop it and I need to. Because excessive gym, I used to work with a client that who would go 5, 6, 7 hours a day. And you can do that in your 20s, but you can't do that in your 50s.
No,
You
it's
can
going to
try, I
catch up.
suppose.
Eventually, you'll catch
Yeah,
up. And
eventually.
we
Yeah.
try and run and run and run away from our trauma and deny it all we want.
Yeah.
But it's going to catch up. It's going to catch up and it's going to catch up big. So if we can face it slowly with support, that's the best time to do it. And I speak from experience when I say this.
Ah.
And how can a person tell if they have complex trauma?
Sorry, can you ask
How
again?
can a person tell if they personally have complex trauma?
Oh, okay. How they can tell. Like if they are in war within, and if they're constantly fighting with themselves for things that they've done or they haven't. And they can tell that they have that. And if they don't have self-compassion, they can have that. They can say that they can have, or they have, not they can, sorry, they have PTSD. And and if, I suppose, if they're doing something excessively that they can't stop themselves, there will be many signs. And I suppose, people would know, CPTSD will definitely alert you that you have something going on because you don't feel fine, you don't feel comfortable, you don't feel in peace with yourself. And when we're a child, we don't know what's going on. This is daily thing that you think this is normal. But after a while, like when we grow up a bit more and then we see other people and then and then we see how we treat ourselves and what others do, then we think, okay, what's going on here? But for me, the first sign is the internal war that you can't win against yourself. Like when you win, then part of you lose. And there's no winning internally, and there's no self-compassion. That's I would say that's how you know.
And is it possible to heal from complex trauma?
Most definitely. Otherwise, I wouldn't do this job.
So there is hope.
Yes, always, always. And my clients sometimes don't have that hope, but I hold for them, and I always will, because there's always hope, and we will change. We will change. Things will change.
Is it possible for a child to have complex trauma?
Is that possible? What?
For a child to have complex trauma?
Of course. Of course. Like, you know, if you've been exposed to developmental trauma and usually that continues,
And
of
continues,
course.
then it is.
Yeah.
And
Yeah.
what age can a child develop an addiction from trauma?
What each
Age
child can do.
and an addiction because of trauma.
Look, I mean anything possible, like, you know,
And it
from
doesn't
eating
mean
this.
like alcohol or drugs,
Yeah, yeah.
but
Like
like
anything
addiction
possible.
can be a very, yeah.
Yeah, look, I mean, from keeping yourself constantly busy to days out and collapse and eating too much, not eating enough, playing too much, fighting, and then making this, you know, your thing, like, you know, because I'm a man or I'm a strong person or whatever that might be, and taking too much risk
Mhm,
and using substance. I don't know. Like, you know, there are some people like starts really early using they start taking their parents' medication
mhm.
because they find, oh, that makes me feel
Take
good.
away the
I'm
pain.
not here. Yeah. So when like, you know, people will find a way to manage
So
because,
a
you know,
very young age.
mhm, mhm,
Mhm. Okay. So it's important for parents to be aware and informed and just notice if there's any changes in your child, extremes,
mhm.
one way or the other. And sometimes it's just little symptoms,
Yeah.
right? Doesn't always be completely obvious, and just let your kids know that you can always go to them and talk to them, and that you are create a very safe place. Because if you can create a very safe place for your child,
Yeah. Yeah.
you are a resource for your child. And that is
Yeah.
significant. My mom has always been my resource. Before I knew what the word resource was, that was my
Mhm.
mother
Yeah.
and my father. So if you can provide that as a parent, that is significant for your child to have that support.
Exactly. Exactly. Like, you know, I mean, safe parents is easy to go to,
Mhm,
or safe teachers, like, you know, I mean, kids try to either through talking someone or with their behavior communicate what's going on in their life.
and sometimes it's not a parent. Sometimes it's a best friend.
Yeah.
Sometimes it's a dog or a cat, right?
Hmm.
Um,
Exactly.
for some people that are spiritual, it can be God. Everyone's different. But it's
Exactly.
finding that resource, that real
Hmm.
life resource in your life
Hmm. Hmm. Exactly.
that can also create a lot of healing. Okay.
Yeah.
And safety is number one
Hmm. Exactly.
for healing.
Safety is number one. Yeah, exactly. Without
And,
safety, this work cannot be done.
and safety is number one for mental health, whether it is addiction, dissociation, PTSD, complex trauma, anxiety, depression, eating disorders, bipolar,
Mhm.
you name it.
Yeah.
Um, finding safety in the body. Today we're going to do a resource. We're going to demonstrate a resource. And if everyone would like to join in, I invite you to do so. I invite you
Hmm.
to have a chair and sit down. And are you comfortable to go into a resource, Isa?
Yeah. 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 Okay. Yeah.
Right? And is there a memory that brings you a sense of safety or peace that we could use? Or we could also use an imaginary place or finding a place in your body that you feel safe. These are different resources that we can use. Do you have a particular option that you'd like to use today?
I like nature.
Nature? Okay.
Mm.
All right. So I said, if you'd like to, and everyone who's watching, if you're comfortable, to close your eyes and keep your eyes closed throughout the process. So if you'd like to close your eyes and keeping them closed, I invite you to ground your feet into the ground. And ground your back against the chair. And just become aware of your breathing. No need to change it. Just notice what's happening in your body, or your breath is like. And if you'd like to ground your feet into the ground and just wriggle your toes, I just notice how that feels. And we're just going to do a simple body scan, working yourself into a resource. And just moving up your ankles. And just noticing if any sensations or emotions arise as we work up throughout the body. Moving into your calves. Your knees. Your thighs. And just noticing if there's any sensations. And what you're feeling. Your glutes. Your thighs. And your glutes moving up to your lower back. Just noticing if you're feeling any sensations or emotions. Just starting to work up your spine. To your upper back. Your shoulders. Maybe like to even wriggle your shoulders around a little. Moving down your throat. Down your arms. To your forearms. Your wrists and your hands. Moving back up your arms to your shoulders. Just noticing your breathing. Moving up your neck to your jaw. Your cheeks. tongue, noticing what you're tasting, what you're smelling. Your nose, your eyes, releasing the tension from your eyes and letting out a sigh. Your forehead, your head, moving back down to your chest, noticing what's happening in your chest. In your stomach. And bring yourself to your imaginary place or memory where Esen is nature. Looking all around you. Looking to the left. Looking to the right. And simply noticing what you see. Looking down. Looking up. Looking far out. Taking in all the sights. Noticing what you smell. What you hear. And if you're starting to feel a sense of safety, I invite you to put your hand to your heart and just hold your heart. Anchoring that sense of peace and safety into your body. So just notice what you hear. And expanding that sense of safety around your heart. And thanking your body for allowing yourself to feel that sense of safety and peace. And knowing that you can come here anytime you need to during the day. And when you're ready, you can open your eyes.
Thank you.
You're welcome. How do you feel?
I feel pretty good.
Okay.
This was so nice, relaxing.
And that's
I
the
feel
first.
very grounded,
Very
embodied.
grounded.
Feel grounded and embodied.
And how does that feel in the body to feel grounded?
I feel inside. I occupy whole body. I feel my legs. I feel my sitting bones, my stomach, my back. Everything is online.
Okay.
Nice
Great.
one.
Thank you.
Okay.
And for those of you at home, I invite and encourage you during this series to try to resource. Even 10 minutes a day, a few times a day is even better. Whatever you feel comfortable and you're able to do, but try and spend just a few minutes, even a day, to go into a resource. And even I also invite you to feel into the body. A few times a day, just notice what's happening. Just close your eyes, have a quiet time, just notice what's happening in your body and what emotions and sensations are coming up. And this is all the first steps to healing, first steps to creating safety. Thank you so much for joining. It was an honor to have you. I have respect for Esen. She's very knowledgeable, and it was an honor to have you.
Thank you. Thanks for having me. It's
Thank you.
lovely to talk to you.
And everyone watching, if you're looking for help, we're both happy to provide a session. Our information will be below. And thank you very much.